is your thyroid medicine actually working for you? I'm going to give you some tips. 4 of them help you gain the successful thyroid hormone replacement. The first one is taking your medicine by itself, maybe first thing in the morning. I've had patients tell me they like to take it in the middle of the night, as long as it's consistent, that is every day, and as long as you are taking it with no other medications, food, and those that are particular for this would be calcium and iron, vitamins. And then there are a number of medications, the acid reflux medications that we call the PPI medications, omeprazole, pantoprazole, Prilosec can inhibit the absorption of thyroid hormone. Then you inhibit its ability to work, and it's not giving you its full value. And so we have to rely on the stomach to absorb the thyroid hormone for the most part. We have to make sure that there's a somewhat of a purity to the stomach at the time of the ingestion of the thyroid hormone. So I always tell my patients to take the thyroid hormone at a time when they're not eating, when they're not using other medications. If they are using other medications, they need to wait at least 30 minutes or an hour, depending upon the medication, in order to get a full benefit of the thyroid hormone. So now let's talk about different manufacturers of thyroid hormone replacement and how that might impact your thyroid hormone potency. And so here's how it works. There are multiple manufacturers of thyroid hormone. Some of them are branded thyroid hormone. If you're talking about T4 products, the branded products would include Synthroid, Unithroid. There are a few others. And then if you're talking about the generic, they're all called Levothyroxine, and you don't know exactly the specifics other than they are T4, okay? Here's the deal. We're treating people with thyroid hormone. We want to be sure that the thyroid hormone replacement has what's called a narrow therapeutic index. What does that mean? It means that it's not a very big distance between what is a normal thyroid level and what is an abnormal thyroid level, which is why when you blood tests, you see that it goes into the, as my patients say to me, into the red zone sometime, outside of the green. And so that's not much different. And so we're constantly trying to make sure that those levels are in that green zone. And the way we do that is by being consistent with our thyroid hormone. And consistency means consistency in the medication itself. So how do we know that it's consistent? Well, if you're using a brand, and there are a couple of different brands, if you use one of those brands consistently, then because the brand is manufactured by one particular company and that company has their own potency associated with a certain dosage, that dosage may be consistent all the way through. So that's one way of maintaining the consistency, is by sticking with one brand. That, though, can sometimes be more expensive and is difficult sometimes for patients to afford that. So levothyroxine, the generic, is much less expensive, and so many people will use the levothyroxine generic. And what happens there is the pharmacy gives you whatever that particular generic is in their stock. And each dosage is still the same. So 100 micrograms of levothyroxine in the generic is still the same as 100 micrograms of Synthroid. However, the manufacturers have a little bit of a leeway in their potency. The FDA has given them the leeway of around 5 to 10, sometimes as much as 15% difference between what a levothyroxine 100 from a generic and a levothyroxine 100 from Synthroid. What's important is not that you get exactly some 100 microgram dosage from one or the other. What's important is the consistency and that the blood tests show that the thyroid levels are consistent. So if you're taking the generic, you want to probably stay with a generic. And if you want to stay with Synthroid, then you use that one again consistently, because your blood tests are going to tell you whether or not that dosage is right for you. And so when you move from one type of thyroid hormone, say Synthroid, to a generic, really you should be retested after a period of time, usually 6 to 8 weeks, to be sure that you're maintaining that same degree of consistency and thyroid hormone levels. So it may just mean a little adjustment in the dosage, and that would be fine. And the guidelines tell us that if you change from one product to another, then you should be retested. One of the problems in this is that sometimes you don't recognize it. And that would happen particularly in the generic world. So if you're taking generic levothyroxine A brand and they give you the next time you refill B brand, you may have a difference of a 10 to 15% in the amount of thyroid hormone that's delivered for that particular dosage. That also may be a situation that would need a repeat laboratory test after 6 to 8 weeks. So this is very much in the weeds. These are very much the details of how thyroid hormone works. But because it's a narrow therapeutic index medication, and because it's so common and so many people take it, there's always the potential for having abnormal levels in the system when there's a change that goes on. My personal philosophy is that if a patient comes to me and says, doc, I think I'm having trouble with my thyroid hormone. I don't feel like I'm adequately replaced. And I just happened to go to the pharmacy and they gave me something that seems to be different. I always will say, well, let's just go and repeat the levels and see where you're at. And we can make an adjustment from there. So important things to be aware of, sometimes not as clear cut as you would hope, but just something to be aware of when you're taking your thyroid hormone. So what happens if you remember that you forgot to take your thyroid hormone? And I think it's important to make it clear that you may not remember that you forgot to take your thyroid hormone. But if you do, if you're taking T4, if you're taking levothyroxine, you can take 2 pills. So let's say it's a Wednesday and you said to yourself, oh, I'm going to take my thyroid hormone today. I forgot to take mine yesterday. I'm going to take 2 today. That's okay. But if you didn't remember that you forgot, then common sense would say just take your 1 pill that day and call it a day. Some people have a pill box that they use and they fill it up and the pill's still there. It's fine to take it the next day as well. Set an alarm on your phone and that will help you remember to take your thyroid hormone every morning. Well, here's the thing that we need to talk about in relationship to how thyroid hormone works, okay? I told you that T4 is a long-acting medicine. And the reason it's long-acting is because it tends to go into the bloodstream and stay there for a long period of time. The pharmacological way of looking at that is what we call a half-life. And so thyroid hormone has 5 to 6 half-lives. It will take 6 or so weeks to be able to get to what we call a steady state. And if we want to measure the thyroid accurately, we have to measure it in the steady state. So I just explained to you in a few sentences a very big concept of what we call pharmacokinetics. To get to a steady state is where we need to be if we're going to take thyroid hormone and be consistent about it and have a consistent level. So 6 to 8 weeks following the thyroid hormone adjustment is the appropriate time to be measured. Okay, here are your 4 tips for success. Take your thyroid medications away from other medications or food. Be consistent with your brand if you can. Remember to take your pill every day and set a reminder if you need to. Be patient with a dosage change and the lab results that come from the dosage change because we need 6 to 8 weeks for those laboratory to reflect those changes.